Welcome dear students, I am Dr. Pratyusha, and in the previous video we have learned broadly about the tumors of middle ear and we have discussed in detail about glomus tumor. Now let us look into the other tumors in this video. So I am talking about the classification once again for all of you. We have benign tumors and malignant tumors. Under benign, glomus is most important. Under malignant, which we are going to deal now, we have primary and secondary. In primary, carcinoma and sarcoma are the two broad varieties. In secondary, we have metastasis and cancers from other surrounding tissues. So let us first discuss about carcinoma of middle ear, and then let us discuss about other tumors very briefly, as they are quite rare and unimportant clinically and from examination point of view also. Okay, so let's move into carcinoma of middle ear. Carcinoma of the middle ear and mastoid is a very rare tumor, but among the primary middle ear malignancies, it is the commonest variety. I hope you have got it. Generally, it's a rare tumor overall, but among all the primary middle ear malignancies, that is carcinomas and sarcomas, carcinoma is more common. It's relatively more common than sarcoma, okay? Most common among primary middle ear malignancies. This carcinoma arises either from the middle ear or it can arise from the deep part of the external auditory canal and extend into the middle ear. Either of them is possible. Now let us look at the etiology of the carcinoma of middle ear. Let us see some predilections. Age. It is seen in the age group of 40 to 60 years. And there is slight female preponderance. Females are affected more than males. And there is an association with chronic suppurative otitis media. Around 75% of the patients have chronic ear discharge, and they are usually cases of chronic suppurative otitis media. Now, what could actually be a carcinoma is probably misdiagnosed as a CSOM. That is one possibility. Or this chronic CSOM, repeated episodes of CSOM, acts as an irritant factor and results in carcinoma later on. Either of them is possible. Another unique and special feature is in radium dial painters. I hope you all are aware about radium paint. It is the thing that shines and that was used in clocks. So in radium dial painters, carcinoma of the mastoid was observed. Primary carcinoma of mastoid air cells. So these are a few points that you need to know from etiology point of view. Now let us move on to pathology. Coming to pathology, we have various types of carcinomas, right? Among the various types of carcinomas, most common is squamous cell carcinoma, followed by basal cell carcinoma, followed by adenoid cystic carcinoma. I hope this is clear. Most common is squamous cell carcinoma, then the next one is basal cell, and least common is adenoid cystic carcinoma. And there is another carcinoma, that is adenocarcinoma. Now this adenocarcinoma arises from the glandular elements of middle ear. Now let us learn about the spread of this tumor. Initially, the tumor destroys all the middle ear structures such as the ear ossicles, facial canal, and then it goes on to destroy the internal ear, jugular bulb, carotid canal. It comes out and affects the deep bony meatus, goes posteriorly and invades the mastoid also. Medially, it spreads towards petrous apex. Laterally, it goes into the deep bony meatus. Posteriorly, it invades the mastoid. But dura mater is resistant to the spread of carcinoma. Please remember that. When we are learning about spread, it affects various structures, but dura mater is resistant to spread, resistant to invasion. Anteriorly, it involves the parotid gland, temporomandibular joint and infratemporal fossa. And via the eustachian tube, it can enter the nasopharynx. Lymph nodes are involved in late advanced stages. Now, the spread is almost similar to the spread of glomus tumor. Actually, if you know the anatomy of middle ear, the spread of tumors is quite understandable and predictable. Okay. Another point that you have to remember is lymph node involvement occurs here. Okay. Now, let us look into the clinical features of carcinoma. There is persistent pain and blood-stained discharge in chronic cases of. Now, let us look into the clinical features of carcinoma. As I have earlier told, this very closely simulates chronic suppurative otitis media. So, when we have to be suspicious is when the age group of the patient is between 40 to 60 years, and along with the regular features of CSOM, if we find any of the following features, then it should raise a suspicion of carcinoma. What are the features? Those special features? First, if there is chronic foul smelling discharge, especially if it is a blood-stained discharge, please become alert. Chronic foul smelling or blood-stained discharge. Next, if there is very severe pain, more at night time. If you remember, glomus tumor has less pain, relatively pain is rare, but here pain is very important and it is very severe, more so in the night time. And then if the patient experiences facial nerve palsy or if you see any granulation tissue or polyp, repeat, or if you see any hemorrhagic granulation tissues or polyp. And finally, if there is any new hearing loss or vertigo, or if the existing hearing loss or vertigo has suddenly worsened, then also that should arouse a suspicion. New or worsening of hearing loss or vertigo. So these are the additional warning signs that you should take apart from the usual features of chronic suppurative otitis media that patients present to you with. So these are the clinical features. Coming to diagnosis, a definitive diagnosis of carcinoma can be made only by taking a biopsy specimen. Biopsy will give you a definitive diagnosis. Apart from that, we can do imaging studies such as a CT scan or angiography. These help in assessing the stage of the disease, the extent and the progress. Coming to treatment, a combination of surgery plus radiotherapy is ideal. When I say surgery, what is the type of surgery that is usually done here? Radical mastoidectomy is done. Commonly, radical mastoidectomy. In case If the tumor has invaded deeply, then we might have to do a subtotal or total petrosectomy. Depending upon the extent of the disease, the decision has to be taken. Radiotherapy is useful for the tumor and also it reduces pain. It's like a palliative measure. Especially when cranial nerves are involved or when the tumor has spread into the cranial cavity, nasopharynx, and it is extensively invading other surrounding structures, radiotherapy is very much useful. So this is about the carcinoma of middle ear. Let me quickly summarize everything for you. It's quite a rare tumor, but among the primary malignancies of middle ear, carcinomas are relatively more common than sarcomas and other tumors. So, etiology, it is seen in the age group of 40 to 60 years. Females are slightly more affected than males, and all the features are that of chronic suppurative otitis media. Maybe CSOM acts as an irritative trigger that will cause carcinoma to occur. And another interesting factor is radium dial painters have been found to be affected with carcinoma of the mastoid air cells. Coming to pathology, squamous cell carcinoma is more common than basal cell, more common than adenoid cystic carcinoma. If at all you find adenocarcinoma, please remember that they arise from the glandular elements of middle ear. And it spreads to all the surrounding neighboring structures, into the deep bony part of external auditory canal, into the nasopharynx, into the petrous part, mastoid, deeper structures into the skull base, and all the surrounding areas. What you have to remember is dura mater is quite resistant to tumor invasion, and even lymph nodes can be involved. Coming to the clinical features, the clinical picture very much mimics chronic suppurative otitis media, but you have to become alert when you see chronic foul smelling or blood-stained discharge, when there is severe ear pain, especially in the night time, and when there is features of facial nerve palsy, or you find hemorrhagic granulation tissue with polyps, or there is new hearing loss or vertigo, or the existing hearing loss or vertigo have become increased, have worsened suddenly. Coming to diagnosis, biopsy will give you definitive diagnosis, and radiological investigations will throw more light about the other details. And treatment is by surgery plus radiotherapy. Surgery depends upon the extent of the disease. Usually a radical mastoidectomy is done. If the deeper structures are involved, subtotal or total petrosectomy is also performed. Radiotherapy is particularly useful when cranial nerves and other deeper structures of the cranial cavity are involved. So this is all about carcinoma of middle ear. Now what else do we have? We have various types of sarcomas and other distant metastasis, secondary malignancies. Now coming to sarcomas, see, they are very rare. Sarcomas of middle ear are very rare. If at all they occur, the prognosis is poor. Prognosis is, these two factors you must remember. Now, if it's a rhabdomyosarcoma, it arises from the embryonic muscle tissue and it affects children and it causes facial nerve palsy. If it is an osteosarcoma, the bone tissues are involved. If it's fibrosarcoma, it arises from the fibrous tissue. If it's chondrosarcoma, it arises from the cartilaginous tissue. So, all these are general points, but what is most important is they are very rare. It's quite possible that you might not see a case of rhabdomyosarcoma or any other sarcoma for a very long time in your career. And if at all they occur, the prognosis is very poor. So this much about sarcomas you got it. Coming to secondary malignancies, metastasis to middle ear is very rare, but sometimes distant metastasis can affect the temporal bone. Carcinoma of the bronchus or prostate or other tissues can land up in the temporal bone. From adjacent structures, say the nasopharynx or external ear, all these tumors can get into the middle ear by bone erosion, or if there is some preformed pathway that is existing, then also these secondary malignancies can occur. So this is all about the tumors of middle ear. Glomus tumor, most important. Have a brief idea about the rest of the classification. Thank you very much and have a nice day.